England and Wales has a diverse ethnic population, around 13% of which are Black, Asian, mixed, another ethnic group, or BAME. People from Asian ethnic groups made up the second largest percentage of the population at 7.5%, followed by Black ethnic groups at 3.3% and mixed multiple ethnic groups at 2.2%. There is evidence that many people from BAME groups may not access palliative care services or have their individual needs met at the end of life. This may be due to a lack of understanding, knowledge and information about end-of-life care. Palliative care is not a common term, and many other languages have no equivalent word for this, and many think of hospices as a hospital or care home. Some feel there is an expectation by others that families should care for their loved ones, and so decline any assistance offered even when it may be very difficult to carry on 24/7. These carers often feel like they haven't got a voice or a choice. This lack of awareness about end-of-life care services and support can be a barrier to people from BAME communities receiving good, personalised care and making choices about where they are cared for. A lack of religious and cultural sensitivity by professionals, along with language barriers and poor communication, adds to the difficulties in both accessing and providing quality palliative care for BAME groups. So what can we do? Raise awareness. Educate staff of all grades about the cultural and religious needs in your communities. By understanding their needs, we can offer tailored services such as knowing the right questions to ask, to understand their culture or concerns, and prompt access to interpreters when needed so we can have more in-depth discussions. Raise awareness within the BAME communities. Be seen and be heard. Go out to the community and support groups and tell them about palliative care services in your area, and that not just cancer but all disease groups can access the services. Offer visits around the hospice and tell them and their families how we can support them to have the end-of-life discussions and receive the palliative care and support that they deserve.